Welcome back. You're watching Eagle News America. I'm Philip Toledo in Atlanta. Canada's public health officials are voicing concern over a possible third wave caused by COVID-19 variants. In Alberta, Thomas Likness joins us this evening with the details. Thomas?
Thank you, Philip. Well, just when we thought we were seeing the beginning of the end of this pandemic, just when we thought we saw light at the end of the tunnel, now we're finding out, the light is still there, but we're finding out the tunnel is a whole lot longer than we thought. And we hope we can avoid seeing scenes like these that were commonplace in the last 12 months. Up here in Canada, those dreaded words have finally been uttered: third wave. That pronouncement came from Ontario's Hospital Association in Canada's largest province. On Twitter, the association proclaimed the third wave was the result of COVID variants. They're just spreading like wildfire throughout the population. New cases of the original virus are decreasing, but cases of variants are on the rise. In Ontario, new strains of the virus make up 49% of the new cases, nearly half. Hospital admissions in Ontario, they're up. The vacancy rate in ICUs, that's going down, and that's something the medical community wants to see reversed. The association warns unless people strictly comply with public health measures, hospitals will be overwhelmed. Chief Medical Officer of Health, Dr. David Williams, admits the province could be headed into a third wave, but how severe will it be? He says that's yet to be determined. Now, earlier today, Premier Doug Ford was asked, did the province lift restrictions too soon? Ford sidestepped that question.
Again, the message to the people, yes, we're seeing the vaccinations roll out, but we can't let our guard down for a second. We have to make sure we social distance, constantly be wearing a mask, follow the protocols of the chief medical officer. We can't let our guard down. So I'd be very, very cautious moving forward.
Ford is in that precarious position of all politicians, trying to balance people's health against the public's cries for fewer restrictions. Not an enviable place to be in. Variants are showing up across the country. Ontario, just the first province to pull the alarm. In Edmonton, Canada, Thomas I. Likness, Eagle News. We live in interesting times. Back to you, Philip.
Thanks, Thomas. Now, I've heard that Canada has changed its recommendation regarding the AstraZeneca vaccine. Is that accurate?
Yeah, we have, and nothing like what they're doing in Europe. You see, we have a couple of different agencies involved in recommendations for immunization up here. One is Health Canada. That would be like your FDA. It approves all medical treatments, drugs, and vaccines. And then we have the National Advisory Committee on Immunization. So when AstraZeneca was first approved, Health Canada said, yeah, use it on anybody over the age of 18. But the advisory committee, they said, hey, wait a minute. There's not enough evidence from the clinical studies on the effectiveness of this shot in seniors, so it recommended against using it on anyone over 65. But now today, the committee says real-world evidence, this was the vaccine of choice in the United Kingdom. They're saying real-world evidence demonstrates that this vaccine is effective in the over 65 demographic. And like I said, this morning they reversed their recommendation. They say it's okay for seniors, but there is a caveat. It says when possible, use an mRNA vaccine. The AstraZeneca is what's known as a virus vector, but they're saying when possible with seniors, use something like the Pfizer or the Moderna because of it's much more effective. And that makes sense, given that seniors have a higher risk of a poor outcome if they get COVID.
Right. But what about all these reports that are coming out about blood clots and side effects, related with the AstraZeneca vaccine? Has the Canadian government commented on that at all?
Well, yeah, they have. Yesterday, the Prime Minister said, as far as he's concerned, the vaccine is effective and it's safe. He tells Canadians, if it's offered to you, take it. Our Chief Public Health Officer this morning said the same thing. But with at least 19 countries not using that vaccine right now, people on the street aren't so convinced. They're concerned. There was a poll just done. 1 out of 4 Canadians who were asked have indicated they're going to be shopping around for the vaccine they want. In other words, what they'll do is they'll put off being immunized until they can get the vaccine of their choice. But hopefully the uncertainty over AstraZeneca can be cleared up one way or the other very quickly. Philip?
Absolutely, Thomas. And I know there's a lot of people on this side of the border that are having the same thoughts as well. So
you haven't even approved AstraZeneca down there, but I would imagine, yeah. Actually, I can tell you, I saw that poll. They did an American poll as well, and 1 out of 5 Americans is kind of vaccine shopping. Philip?
Absolutely. Well, thank you so much for joining us tonight, Thomas. You stay safe.
You too.